Hello, this is a continuation video. Osteoporosis is a defect of osteoclast. When osteoclast they do not function properly, there will be a deposition of the bone. I will write it down, defect of osteoclast. Now there will be irregular deposition of the bone, and the bone will be defective. It will be it cannot withstand that much load, so it will tend to fracture. Now what's the function of osteoclast is the blood supply of the bone is established when the osteoclast they cut down the bone. After that only blood supply of the bone is established. So blood supply, so when there is defect of osteoclast, there will be defective blood supply of the bone also, of the bone. Now in case of osteoporosis, like if a patient comes to you for extraction, like here we have molar and you need to extract this molar, but the person is having osteoporosis. Now what will happen is there will be a chances of the person to develop osteomyelitis. Why? Because there will be a lack of blood supply to the bone, so it will lead to osteomyelitis in the patient with having osteoporosis. I'll show you a picture of that also, how it will look like. Hold on, I'll rotate it. It will look like this. If you can appreciate this osteomyelitis in the posterior alveolar region. So you need to take care of this thing. If the person is having osteoporosis and he or she comes to your clinic, then you must not directly go and extract his or her tooth or any molar or something. Okay, so coming on to the features of the osteoporosis. First is defective osteoclast, as I already have written over there, defective osteoclast. And there will be thickened sclerotic bones, and there will be defective remodeling of the bone, remodeling of woven bone, newly formed bone, of woven bone. Now osteoporosis is of three types. One is infantile. Okay, I will write it in black to differentiate. Infantile. The other one is of adult type, and in between there is intermediate type. Intermediate. Now this is important: infantile, intermediate, and adult type. In infantile type, it will be inherited as autosomal recessive, and the adult will be inherited as autosomal dominant. And it can be either intermediate, can be either dominant, or either it can be recessive. Okay, so first of all we'll discuss about infantile osteoporosis. Now this occurs in younger age group. Obviously it's infantile, it will occur in babies only. So in this there will be a continuation of the bone formation without any resorption. That will lead to compression of the cranial nerves, continuation of bone formation, and this will ultimately leads to compression of the nerves, and that will ultimately lead to blindness. Other features will be like sleep apnea. The baby will be having difficulty in having sleep, and blindness will be due to retinal damage. There will be facial nerve palsy also, deafness. Now in this I have already told you that there will be defective blood supply of the bone, and if there will be defective blood supply of the bone, there will be a load on the liver, so it will lead to hepatosplenomegaly. legally. Now, this also is the main feature you need to remember. There are MCQs on that. Another thing which you need to remember is, in case of osteopetrosis, there occurs enamel hypoplasia. Now we'll be discussing about the radiographic features. Radiographic features. So, as you know, there is deposition of bone. So there will be many radio opacities also. But in osteo, now we'll be discussing about the radiographic features. So the striking radiographic features you will see it on axial skeleton, which are our long bones skeleton. These are our long bones. We'll see like some radio opaque mass, and there will be like radio lucent, again radio opaque, again radio lucent in our vertebrae. So this will give a look like we'll see it like a sandwich vertebrae, or you can say rugger jersey spine. Rugger jersey spine, if you know, the footballers used to wear rugger jersey spine. Okay, and you will also see bone in bone appearance, as there will be some part that will be radio opaque. It will give appearance of bone in bone appearance, and we call it as Ehler-Meyer flask. Now these are important features: Ehler-Meyer flask, rugger jersey spine, sandwich vertebrae. These are striking radiographic features of osteopetrosis. Now we'll see lab findings in osteopetrosis. So first of all, there will be increased creatinine kinase, and second one will be increased tartrate resistant acid phosphatase. And third, there will be hypocalcemia. Now, if there will be hypocalcemia, the body will try to leach out. Why there will be hypocalcemia? Because for formation of the bone, the body needs calcium. So there is excessive bone formation and reduced bone resorption. So there will be utilization of the calcium much more than the normal. So in body there will be less amount of calcium in our serum. So our body will try to leach out calcium from the bone. This will lead to secondary hyperparathyroidism, because parathyroid, as you know, is responsible to leach out calcium from the bones to the blood. Hyperparathyroidism. And that's it for the osteopetrosis. And next we will be discussing about fibrous dysplasia in our next videos, and all other diseases of the bone we will be discussing next. Thank you so much.